Before discussing more about how to do the supraorbital nerve block, I think we need to understand a little bit of the anatomy. So I've got John Dutton's textbook here on clinical anatomy, and I want to show you this picture here. Here's the eye socket, here's the nose, here's the ear for orientation, and you can see this first branch of the fifth cranial nerve comes up through this little notch. This is the supraorbital nerve. Now there are other branches that can sometimes be involved, but far and away the most common is the supraorbital nerve. Now the supraorbital nerve really has three branches of pain sensation. One goes directly behind the eye, one that comes up across the brow toward the ear, and one that goes straight up the forehead. And any one of those three, or all three, can be involved in a supraorbital neuralgia. As you saw in the picture, there can also be a supratrochlear nerve that comes a little bit over this way, and then there's the zygomaticotemporal and the zygomaticofacial nerves out here on the side. But far and away, the most commonly affected nerve is the supraorbital nerve right up here. So on this skull, which is actually a pediatric skull, you'll see there's a notch in the bone here, another one over here. If you can't feel the notch when you're feeling the patient, you know that it's about a third of the way from the nose to the ear along this bone. So even if you can't feel it, you know that that's about where it is. Okay, so to prepare the injection, we take an alcohol swab and we wipe off the top of the bottles. I'm going to use a combination of Marcaine, which is a slow onset, long duration anesthetic, with a faster onset, shorter duration anesthetic. At home, you'll probably just use this, but you can have a combination of both. We open our syringe, keeping the tip sterile, and here's a larger needle. We use this to draw up the injection, and I'll mix this. Here we're drawing up a little bit of the lidocaine, and now I'll mix it with some bupivicaine or Marcaine. Be very careful when you recap the needles that you don't stab yourself. And now we use a smaller needle for the actual injection. And then we're ready to go. The first thing we're going to do is prep the patient. And now we will feel for the supraorbital notch. So I'm feeling along the bone here, and there's the notch. I feel it way over here. Out of that notch there comes three structures: an artery, a vein, and a nerve. You want to be very careful not to puncture the artery or the vein or the nerve. And so to do that, we come under the brow, we tent up the skin. Now that I'm tenting up the skin, there's no way I'm going to hit those things. And now I just come tangentially, and now I can slowly inject. The anesthetic hurts, so we want to go slow, and it won't hurt so much. And usually you put about 1 to 2 cc's. As you're putting more volume in here, you can see it's coming down into the eyelid, and it may make it difficult to close the eye, it may make it difficult to open the eye. And I'm just going slowly here. Again, I'm far away from the nerve, artery, and vein because I pinched up the skin. Okay, so now we're done. And what I'm going to do is I'm going to ask her if she starts feeling numb up here in the forehead. By the time she starts feeling numb in the forehead, the pain should be going away. And I can actually push the anesthetic up into the notch if I want to. You can manipulate it, make it go where you want it to go. Are you beginning to feel numb here?
Yes.
This is beginning to feel numb?
Mm-hmm.
And is your headache getting better?
It is.
Great.